everyone, welcome back. You're on with Dr. T. And I wanted to discuss a topic that I've seen come up, quite a bit over really the last several years. This topic kind of continues to come up, and I've recently seen a little bit of a resurgence of it. And in working with parents and children, it comes up quite a bit. And that is the topic of ADHD, or attention deficit and hyperactivity disorder, what previously used to be called attention deficit disorder. So I want to start by saying that when it comes to psychology and mental health, diagnoses really are just a way to describe trends in behavior. So you can tell a lot about the norms of behavior, what's considered normal, what's considered abnormal, based on what specific diagnoses are considered. Now, keep in mind that the Diagnostic Manual that's used by psychiatrists and psychologists and counselors isn't updated that frequently, so it's not a perfect descriptor of the current trends. It's really like long-term trends, what's considered normal or not. So, the recent debate that I've seen is ADHD a real disorder? And that's really been out for quite a while. But if you keep that context in mind, that really it's just a way for those who work in mental health to have a way to describe certain combinations of symptoms, then you can understand that, there's no absolute when it comes to diagnoses. It's really just a way to talk about certain behaviors. And so with ADHD, and even the change from ADD to ADHD, really all that means is it's a way for those who work in mental health to talk about behavior combinations that are related to attention, right? Attention issues, hyperactivity, behavioral issues. So if you start there and say, okay, we'll just accept the fact that this is a quote unquote real disorder. The next step then is to really talk about, well, what can we find out by looking at this combination of symptoms, right? So often when you have behavior, what are considered behavior problems, behavior challenges with children, often those behaviors can be a symptom of system instability. What does that mean? Well, the child's home life, mostly, right? Either there are problems at school that are being displayed by the child, or there are some sort of challenges at home. And so a wide range of things can be considered instability in the home. Some of the more serious are things like abuse, physical abuse, sexual abuse, even emotional or psychological abuse are very important. And the child's, what we see as the child acting out can be a symptom of that. There can be a wide range of relationship problems. The parents, either one parent and the partners that parent is having relationships with, or the child's actual parents, if they have marital problems, if they have, if there's relationship abuse going on, if there's a lot of arguing among parents or the parent and the kids, then the child acting out can be a symptom of that. They can also be a symptom of what are called attachment problems, meaning an actual relationship issue between that parent and that child. Either the child isn't feeling loved, or the child isn't getting enough attention, or other things. Or it can just be an overall symptom of problems with structure in the home, that things are not stable enough, there aren't enough boundaries, there aren't enough rules or expectation about the rules, or information being given about rules. So those are just a few of the things that often really a child's misbehavior can be a symptom of those things. And then in some cases, it really can be something neurological going on with the brain that makes it difficult for the child to pay attention. So it's important for parents and caregivers to try to assess all of those things and to refer to a professional to help you with assessing those things if the situation warrants it. So if you have questions or similar issues related to this topic, you can feel free to post a comment below. You can visit me at my website, www.drtmedley.com, for information about trainings or continuing education for those who work with children, for example, and a possible other wide range of services that are available if you are interested. So let me know what other topics you want to hear about. And you can reach out to me on Twitter as well, New Day Life Skill, NEWDAYLIFESKILL, or on Facebook at New Day Life Skills with an S. I hope to see you all soon, and I look forward to posting the next topic.